Action.
Hey everybody, Sean Grisby here with Ski Patrol Tips. Today we're going to be covering backboarding. For this demonstration, as per usual, we will not be going through a full assessment, so we won't be taking off the patient's hat or anything like that, but we are just going over the skill of backboarding the patient. Of course, with any scenario, we've already checked for scene safety and covered universal precautions, and we would be checking CSMs before and after. Again, we're just showing you how to backboard this patient. So today I have two patrollers, Nuki and Emma, helping me out, and our faithful patient, Hannah, who is also a patroller on the floor, injured. Okay, so we suspect a C-spine injury with Hannah for whatever reason. It could be MOI, but we are going to be backboarding. So the first thing we're going to do is we're going to maintain manual C-spine stabilization. So I would respond and I'd make my call that I'm holding manual stabilization. Okay, Emma, can you please take over C-spine? You may have to come around the other side.
Okay, so I can just slide my hand in there.
Okay,
Got it.
perfect. Okay, so Nuki, we are going to realign Hannah's extremities, okay? So I'm going to stabilize her hips here. Can you please straighten that leg? Okay, and I'm going to stabilize her shoulder.
Use my arm across her.
Yes, that would be perfect. Okay, great. Okay, so now we're going to get the C-collar out. Okay, so I'm going to measure my C-collar. I have already measured Hannah, and I know that she is on the no neck function here, because oftentimes we're on the slopes, people who have all the gear on end up being no necks. Hannah has a average sized neck. For this scenario, we're going with no neck. Okay, Yuki, can you assist me in putting this on? Okay. So when I put the C-collar on, it's helpful to clear the patient's hair out of the way. First thing I'm going to do is set the chin. Got
a lot of hair back here.
Hannah, can you breathe okay?
Yep.
This isn't restricting your airway at all?
No.
Okay. Okay, great, perfect. So Emma, just maintain C-spine stabilization, okay? All right. Nuki, can you please grab the backboard here?
Yep.
We're going to roll Hannah towards me, so place it right over there. Okay, you can lay it right on the ground, that's fine. Okay, I'm going to stabilize her hips. Can you please cross her leg down there?
Yep.
And come over to my side. Okay, great. Okay, so Emma, we're going to roll so I can palpate Hannah's spine, okay? So on your call, we're going to roll, okay? All right.
Is anyone not ready? And we're gonna roll on one. So, or we're gonna roll on roll. So 3, 2, 1, roll.
Okay, all right, you got it?
Yep.
Okay, I'm gonna palpate, reaching through the C-collar here. Hannah, just let me know if any of this hurts, okay?
Yep.
Do you feel me touching all your vertebrae?
I do.
So I'm touching every vertebrae down Hannah's spine. Walking all the way down, feeling for step-offs, any kind of deformity. I'm going to work all the way back up. It's important to hit every single vertebrae, because if you find any pain on any vertebrae, then that needs to be documented and relayed to higher care when they arrive. Okay. Did you feel any pain there?
No.
Okay. Okay. When you're ready, we can lower her onto the...
Alrighty. Anyone not ready? Roll on roll. 3, 2, 1, roll.
okay? You get on the pelvis?
Yep.
Okay, can you guide us? We're gonna go
Yes.
to the side and then up.
Okay. So just you think one movement for this,
We can do one movement.
or two, over?
If we can do one, one's fine.
Okay,
Yep.
awesome. So, anyone not ready? 3, 2, 1, lift.
Okay, perfect. Okay, you're gonna keep on maintaining. All right, can you stabilize?
Yep.
I'm gonna get the spider straps out. And we're putting some padding underneath Hannah's lower spine here, because that can be pretty uncomfortable. Hannah, I'm just gonna reach over you, okay? Put some padding here. My padding underneath your legs there. And I'll stabilize her pelvis if you don't mind just uncrossing her legs a little bit as well. Okay. All right, so we've padded below. You mind maintaining pelvic stabilization? We've padded underneath Hannah's knees and lower back in the lumbar area, because if you know in your lumbar area, there's a little curve there, and it can be pretty uncomfortable being put on a backboard without having some padding under there. Okay, so now I'm going to lay out my spider straps. Can you get those two lower ones? Okay, so a lot of people get worried about where the placement of these straps is. Remember, you want to be maintaining the stabilization of C-spine from, and your C-spine is from the pelvis to the head. So this is the most important region. Don't get hung up over where these straps hang up. As long as they're holding the legs in place, that's fine. You don't want to go right over the knee, which these straps weren't. Okay? Nuki, can you please assist me on strapping? We would have another patroller here maintaining stabilization in the pelvic area this entire time. But Nuki's going to help me set up these straps. Okay, so we'll go to the one just below the head pad there. So we're going to go loose at first. Okay. So first we're putting the straps on loose, because we'll come back and retighten them afterward. But if you do them tight at first, then it's going to misalign the straps all the way down. Right by your hips. So I'll tighten these. Now I'm going to do the final tightening here. Hannah, did that affect your airway at all? Didn't push too hard on the seat
Did
collar?
not.
Okay. Can you hold her shoulders? Okay. Hannah, can you take a deep breath for me? Okay, perfect. Okay, getting these lower straps here. Okay, finally, we're just gonna, a little odd, but it's sometimes it can be helpful, especially if you're skiing a patient down in the toboggan, to just sort of loosely tie their hands together like this. Hannah, do you mind if I tie your hands together like this? Sometimes it makes patients feel a little weird having their hands tied together like this, so you don't have to do it in that instance. Okay, so now I'm going to take over C-spine stabilization here with these head blocks. This is the last step. Okay. Here we go. All right, I have it.
All right.
Okay, can you hold those? Excuse me. And then finally, Yuki, can you put that on that side? The loop? Yep, sure. Okay, some patrols like to also use a chin strap. We feel that the head strap is adequate. So head strap, or forehead strap, and a C-collar is adequate with the head blocks. Notice that the head blocks were the last part of this splint that we put on, because if you were to put the head blocks on first and her body were to turn, then obviously you're compromising her neck, her C-spine in that regard. Okay, so this is how you backboard a patient. How's that feel, Hannah?
Pretty good.
You probably want to get out, huh?
Pretty tight.
Okay, great. And if a patient does throw up or feels like they're going to throw up, we can turn the backboard on its side just like this. And I'm not going to go all the way. And then we bring them back down here and we make sure that they have a clear airway. Finally, we check CSMs and transport. Thanks for watching.